Hi, my name is Peter Peñarrera and I'm going to talk about Koilonychia in iron deficiency anemia. First, the definition. Koilonychia, also known as spoon nails, is a nail disease that can be a sign of hypochromic anemia, especially iron deficiency anemia. It refers to abnormally thin nails, usually of the hand, which have lost their convexity, becoming flat or even concave in shape. In a sense, Koilonychia is the opposite of nail clubbing. In early stage, nails can be brittle and chip or break easily. Koilonychia is associated with Plummer-Vinson syndrome and iron deficiency anemia. It has also been associated with Lynch planus, syphilis, and rheumatic fever.
Koilonychia is a change in the character of the nail plate, usually a concavity in the nail, and is indicative of something, again, systemic, but more specifically, oxygen content of the blood going to the toenail. So we think in terms of lung infections, emphysema, some type of problem with the lungs that doesn't oxygenate the blood enough to cause the most distal part of our body to grow properly. Koilonychia, cupping in the nail. And the same thing with club nails, where the nail changes to the opposite position, because the nail is starved for oxygen. I think if you see a change on the nail plate to that degree, whether it's clubbing or Koilonychia, I think it probably does relate to a more systemic disease. I would start with your family doctor first, then maybe a dermatologist, then get a general physical exam to look to the part of the body that might be causing it. The reason that the nail shows lots of different pathologies is because the nail is very sensitive to oxygen content. And oxygen content comes from the blood. Blood is oxygenated at the level of the lungs. So most of these changes we see in the nail plate most likely are associated with lung-type diseases. But I don't know that I would run directly to a pulmonologist. I would see your family doctor, follow up with a dermatologist, and then be referred to a pulmonologist. But I think it is a serious disease.
Applications in medicine. Koilonychia can be hereditary, acquired, or idiopathic. Acquired causes are common, which include inflammatory dermatose like psoriasis or Lynch planus, onychomycosis, secondary to anemia and traumatic or occupationally. Koilonychia occurs in 5.4% of the patients with iron deficiency. It is thought to occur due to the outward deformation of lateral and distal portion of pliable iron deficiency nail plates under mechanical pressures.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has three main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, A diet that does not have enough iron, folic acid, or vitamin B12. Blood disorders such as sickle cell anemia and thalassemia, or cancer. Aplastic anemia, a condition that can be inherited or acquired. And G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
Pros and cons. The most frequent cause of spoon nail is iron deficiency anemia, but spoon nails can also result from trauma to the nails, chemotherapy or radiation therapy for cancer, frequent exposure to petroleum solvents or detergents, inability to absorb nutrients. Some of the diseases associated with spoon nails are celiac disease, diabetes, heart disease, lupus, protein deficiency, psoriasis, Raynaud syndrome, vitamin B deficiency.
Hi guys, Dr. Berg here. In this video, we're going to talk about spoon nails, where your nail starts bending backwards. Okay, that is an iron deficiency. And some of the common causes would be an ulcer, some type of malabsorption problem in your intestine, hemorrhoids, colitis, which is inflammation in your colon because you can't absorb it. But probably the most common cause is low hydrochloric acid in your stomach. And because you need a strong acidic stomach to absorb these minerals. If you don't have a strong acid stomach, you also get heartburn, acid reflux, GERD at the same time, and indigestion. So that's why it's so important to get that stomach really working good. So even if you're a vegetarian, you may get non-heme type iron from, here's some good sources like yellow beans, spirulina, spinach, lentils, ginger, sesame seeds. But those are only absorbed a certain amount. But the actual active form of iron that goes into the blood and helps you carry oxygen, that basically comes from more animal products or seafood or fish. Clams, by the way, have the highest amount of iron. Then pork liver, I know you're going to probably do that, right? Lamb kidney, oysters, octopus, mussels, red meat. So all the foods that a lot of people don't consume on a regular basis. So it could be just some basic malabsorption problem in your intestine. That's a real common thing as well. IBS, which is irritable bowel syndrome, again, another inflammation in your gut, or parasites, okay? So if you have a problem with spoon nails, you just want to start consuming more iron. If you want to get it as a supplement, get the food-based ones, probably some liver pills, some grass-fed liver pills. That's what I would do. So in summary, we want to find out the cause of why you're not absorbing iron. It's rarely lacking in the diet. It's mainly one of these right here. All right? Thanks for watching.
Issues applies in Ecuador. There's no document for this type of illness. In conclusion, iron deficiency may be difficult to differentiate from other causes of anemia, particularly chronic disease. Both iron deficiency anemia and anemia secondary to chronic disease are microcytic and hypochromic, and few tests are specific for iron deficiency. Bone marrow examination is rarely necessary anymore, except in patients who fail to respond to iron therapy. The diagnosis of iron deficiency anemia demands an investigation of its cause. Thank you.